You don't know me. Probably never will.
But I need you to do something for me.
Something that could literally
Change everything.
You'll never get a thank you card.
And yet, I need you to do it.
And if that weren't enough, I need you to do it as soon as you are able to.
If you do this for me,
I'll do it for you.
And for every single person you love.
Deal?
This is our shot to leave COVID behind.
Good morning, everyone, and welcome to our next breakout session entitled Making Safe Sleep Accessible and Inclusive. Our panelists joining us on today, we're joined by Barb Himes, representing First Candle SIDS Alliance. Also joining with her is Jacqueline Corbin-Armstrong, representing the Office of the Chief Medical Examiner. Also joining with us today is Sharon Brandon, representing the Department of Health. And with us also is Dr. Kristinza Giese, representing the Office of the Chief Medical Examiner. Now at this time, let us now receive Jackie Armstrong.
Thank you so very much. I am just so grateful to have the opportunity to work with these fabulous individuals from DC Health, the Office of the Chief Medical Examiner, and First Candle. It is our honor to present this information about making safe sleep accessible and inclusive. You are going to hear information about safe sleep, the work at the Office of the Chief Medical Examiner and the Fatality Review Division that helps to review gaps in systems and services, as well as what's going on the national front in terms of making safe sleep inclusive and accessible to our families. At this time, I'd like to move into Sharon Brandon from DC Health, who helps to facilitate all of the safe sleep training in the District of Columbia. Thank you.
Thank you, Jackie, and good morning to you all. Sit back, take notes, and if you have any questions at the end of the total presentation, there'll be ways to get in touch with each one of us. Next slide, please. Okay, the overview is going to be the difference between sudden unexpected infant death, which is pronounced SUID, sudden infant death syndrome, which is SIDS, and other sleep-related deaths. Also, what the American Academy of Pediatrics Task Force recommends and why their recommendations are important, and the DC Health Safe Sleep Program. Next slide, please. Okay, for those who don't know, SUID is the unexpected death of an infant whose manner and cause of death are not immediately obvious prior to investigation. Sudden infant death syndrome is the sudden and unexplained death of an infant younger than a year old that doesn't have a known cause after a complete autopsy. And the Office of the Chief Medical Examiner will go more into that. Next slide, please. SUID, we have to remember, is not a diagnosis. It is an umbrella term. On the right-hand side, you will see the writing in red. Those are sleep-related deaths for infants: suffocation, asphyxiation, entrapment, and of course, we have SIDS. On the left-hand side, if an infant dies before their first birthday, those are all included under the SUID umbrella. Next slide, please. These are the Office of the Chief Medical Examiner terms. So we're going to let Dr. Giese address these. Next slide, please. The American Academy of Pediatrics tells us to place the baby on his or her back for every sleep. That's nap time and nighttime on a firm surface, such as a crib or a bassinet with a tight fitting sheet. We tell in our trainings, we don't want you to put a twin size sheet on the beds. We don't want you on the bassinets to try to fit a pillowcase. It has to be the sheet that is for that sleep environment. Avoid the use of soft bedding, blankets, pillows, toys, bumper pads. Those things should not be in the baby's crib. It should be bare. And then they suggest sharing the room with the baby, not the same sleep surface, at least until the baby turns a year old. If you don't do it to a year, then we say 6 months. Room sharing is shown to decrease the risk of SIDS by as much as 50%. Room share, not bed share. The products that they have on the market that go in the bed are not safe for the baby. They can still tip in the direction of whose weight is the strongest, which is the parents, and the baby can still tip in that direction. So we say do not share the same sleep surface, and avoid the baby's exposure to smoke or persons that are using illicit drugs or alcohol. And we go more into that in our trainings that are provided. Next slide, please. Avoid overheating. Dress the baby in appropriate clothing. We say no more than one layer than an adult, but we also explain if the adult is anemic, then one layer of clothing is good for the baby. We say put more on the adult, but do not put more on the baby, because babies release through their head and through their feet. If you put too much clothing on them, it suffocates the body. So dress them in comfortable clothing, and there are wearable blankets. So we do not need to put blankets on our babies now. That is also in our trainings. Breastfeed. That's also recommended by the American Academy of Pediatrics. It shows that it has a protection against SIDS, ideally for the first 6 months. If mom has a problem with baby latching on, all of that information they can get before they leave the hospital. After feeding, American Academy of Pediatrics encourages parents to move the baby back to their own sleep area. Do not fall asleep with the baby in your arms. Infants should receive all of their recommended vaccinations. And do not use the home monitors. My thing is that boppy pillow. The boppy pillow and other devices, wedges, should be used like tummy time. They need to be supervised. The babies should not be sleeping with them in their sleep area. Next slide, please. This is the ideal safe sleep environment. If we follow these tips, our babies will be able to make it to their first birthday. Next slide, please. Education is important because African-American babies are at higher risk for SIDS. Now, when Jackie and I do these trainings, we say don't get SIDS mixed up with unsafe sleep. 46% of district residents are African-American. That's why education is important. We don't just give the baby bed or the sleep environment to the parents. We want to make sure that you're educated on what safe sleep practices are for your baby. Next slide, please. These are some references. Next slide, please. Okay, DC Health provides a train-the-trainer model for teaching safe sleep to our partner organizations, including clinical settings, managed care organizations, homeless shelters, social service agencies, etc. The Safe Sleep program also provides portable cribs to our partner agencies, and they are free at cost. For more information, you can contact myself, Sharon Brandon, the DC Safe Sleep Coordinator, and there is my number and email address. And before I end, I would like to thank, along with DC Health, all of our Safe Sleep partners, because through this pandemic, we have seen amazing work from all of our partners. I can't start listing them because there are many, but it was a job well done with keeping in mind social distancing. We had all of our partners that went right to educating online and finding the safest way to get the portable crib to their families so that all of our babies in the District of Columbia were serviced. All the families were serviced. And we would like to thank you all for a job well done. Next slide, please. Remember that our babies sleep safest alone, on their back, and in their own crib. Thank you.
Next slide, please. Sharon, thank you so much for that wonderful presentation. I would just like to echo Sharon. The trainings that continued during the COVID-19 pandemic were just exceptional. And we know that we are delivering the best information possible and resources to our district's most vulnerable residents. After Sharon, I'd like to share with you information on the unsafe sleep-related deaths that we see here in the district, so you have a real understanding of where our data comes from, why we are so emphatic about educating our families. And what you'll see before you will be a 4-year review supporting the need for that inclusive and accessible education and prevention for our families. As Sharon mentioned, there are some terms and there are some methodologies that our Deputy Medical Examiner, Dr. Kristinza Giese, is going to explain to you. So I would just like you to know that I am the Child Fatality Review Specialist for the Office of the Chief Medical Examiner, Fatality Review Division, also having done Infant Fatality Review. As I mentioned, Dr. Giese is one of our medical Deputy Medical Examiners for the Office of the Chief Medical Examiner. And before I let Dr. Giese give us some information, I just want to thank the Fatality Review Division as well. Catherine Barnes, Tracy Martin, as specialists reviewing the cases so that we can determine what are the gaps in systems and what are the trends that the district should address, especially in regard to infant safe sleep, and our program manager, Jenna BBIE, for her tireless support and assistance in everything that we do. Next slide, please. And so, Dr. Giese, would you like to talk a little bit about the investigative process before I go further?
Certainly. Thank you so much, Jackie, and thank you, Ms. Brandon, for that presentation. I also want to say thank you for inviting all of us to come speak today about safe sleep. So I just wanted to touch on a few things that the Office of the Chief Medical Examiner does when we investigate these deaths. We have a number of pathologists who perform autopsies, and we have staff that are investigators who are ABMDI board certified. That means that they've seen a certain number of fatalities and investigations in order to be trained to get the proper information in order to help us determine the cause and manner of death. So when our office receives a call about an infant fatality, the investigators will report to the scene and try to get as much information as possible. They're extremely thorough, and oftentimes this takes several days to get the information. One of the most important things that we do and take part in is the doll reenactment. So if there is an unsafe sleep environment, we provide a doll and we ask the family member who is in bed with the infant to demonstrate how the baby was found and how the baby was put to sleep so that we can identify any changes in position. I want to thank everyone who's in attendance, especially those who aren't parents, who are caretakers or other family members, because some of the things that we see are that infants are placed in bed with the family member after an adult is asleep. And it's important to make sure we get this safe sleep message, not only to the parents, but also any other caretakers, including siblings, aunts and uncles, and grandparents. So thank you again for attending. To clarify some of the terms that were used earlier, as mentioned before, SUID is not specific. Our office is very thorough in our investigation, and I just want to give a shout out and commend our investigators on all their hard work, not only for being thorough in their detail, but also dealing with families who are probably going through some of the worst days of their lives. So they report to the scene, They get this information, and what they do refer to is something called a SUDI form. If you're interested in learning more information about the specific questions that are asked, this is a multiple page document that not only asks how the baby was positioned and found, but it asks the mother, when did you first know you were pregnant? So we're getting history, medical history. We're getting from the mom, we get medical history from the infant. We try to find exactly what objects were on the sleep surface. They're extremely thorough about getting all of that information. And it's pertinent that we know all of that so that we can let the family know what happened to their infant, and also to prevent that from happening again. So the other definitions, SIDS in particular, our office doesn't use that definition when we sign out death certificates. Sudden infant death syndrome is really like a diagnosis of exclusion. It's saying that we did as much as we could and we don't know the answer for sure. So we use the term undetermined. And that's very important to distinguish, especially when you start to read through data and literature, even when you go to the CDC website. Sometimes these terms are grouped together or they're interchanged. So it's very important that you pay close attention to what the terms are that are being used. I think I covered mostly everything. Is there anything else you need me to say?
No, Dr. Giese, and I thank you so much for that explanation of the work that goes on at the medical examiner.
Thank you.
Not at all. And so Dr. Giese just gave an amazing explanation of the intense and robust work that occurs in terms of investigations, the pathologist, everything that goes into an investigative stance for our fatalities. What we do at the Fatality Review Division is we then take all of that information along with contacting and receiving information from all of the components and facets that touched on this family: child welfare, behavioral health, healthcare finance, to make sure that there was medical insurance so that they could receive their medical care as needed. We get prenatal, well child. We also, if we need to, get MPD or police department information, school information. We gather everything. So as Dr. Giese said, we do an extensive review to look at the circumstances surrounding the fatality. What you see on the slide ahead of you is over the course of the 4 years, what we did was compile all the information and we extrapolated the deaths that had to deal specifically with unsafe sleep. And that comes straight from the medical examiner after doing the investigation. So for your knowledge, in 2017, there were 6 fatalities that had an unsafe sleep component. That could be shared beds, sleeping in an adult bed, having soft pillows or blankets or bumper pads surrounding the infant in the crib, being on a sofa, sleeping on another person. So all of that comes into unsafe sleep. In 2018, we reviewed 10 fatalities that had an unsafe sleep component. 2019, we had 14 fatalities that we reviewed that had an unsafe sleep component. In the 2020 review, we looked at 8 fatalities that had an unsafe sleep component. And over the course of time, what we have seen is that number has gone up and it has increased. In the cases we've reviewed. And what I want to share with you is that although we know that our infants die at greater numbers due to complications of prematurity as that leading cause of death, right after that, we see that our infants are dying at higher numbers due to being placed in an unsafe sleep environment. Also, for your information, what we do is a review over time. It is not surveillance. So we have the opportunity to see things over the course of time and then gather that data. What I want to talk about 2020 is that due to the state of emergency, we didn't do reviews every month. So although the number seems low, over the course of time that we did the reviews, we have seen those fatalities in a higher rate. Next slide, please. What we also know is that, as Sharon said, the district residents that suffer some of these fatalities are usually African American because of the population. And what we also know is that we have fatalities at greater numbers in wards 7 and 8. So the district is really trying to target not only the entire community, but those that are most vulnerable for having an infant death. So the 2017 reviews, and what I want you to look at is what you see in terms of social environmental data is that people are at different levels of stress. 4 of our families had a history of child welfare involvement, 3 experienced housing insecurity, 6 families experienced financial insecurity, which can range from having Social Security, supplemental insurance, SNAP, WIC, also receiving housing assistance. What I want us to think about is during yesterday's plenary, our mayor talked about how housing insecurity, the ability not to have safe, affordable housing negatively impacts any health outcome. So that's why we like to focus on some of this data. 4 of our families experienced mental health concerns and received services. We also heard in yesterday's plenary that mental health can be unaddressed and that negatively impacts our families. 7 of our moms reported using marijuana and 3 reported using tobacco products. What's important about that, as Sharon also mentioned, our infants need to be in a smoke-free environment. We know that air quality and smoke will impact our infants' health outcomes. So we like to track and keep a note of this information to see where training can be done. Next slide, please. Before I go into this information, I would just also like to echo Dr. Giese. Please look at the OCME website for all of the information that is reported out to the community in terms of fatalities in the district. So in 2018, the review revealed 10 of our families had a history of child welfare involvement. That can mean educational neglect, medical neglect, things of that nature. 6 of our families also had mental health concerns. 13 families experienced financial insecurity and/or housing insecurity, which is really important to help people feel safe in caring for their infant. 6 of our moms reported using marijuana and 8 reported using tobacco products. Here again, we're looking at the smoke environment that perhaps our infants were exposed to. Next slide, please. The 2019 review, we saw 10 families with a history of child welfare involvement. 6 of our families we saw this year had a history of intra-partner violence or domestic violence exposure. So that also impacts how our families cope, how our infants are being cared for due to the stress perhaps that the family is under. 13 families also experienced financial insecurity, housing insecurity, and 6 of our moms reported using marijuana and 8 moms reported using tobacco products as well. Next slide. So the 2020 review, we had 5 families having housing insecurity, 5 with a history of untreated mental health, which is also important because we could see through the review that they were suffering and there were concerns, but had not moved into what we would have called a formal setting for services. 7 families had a history of child welfare, 8 families had housing assistance, housing insecurity, financial insecurity. 7 infants were exposed to tobacco products, and 7 of our moms did indicate that they used marijuana and tobacco during their pregnancy and at the time of the fatality. All of this playing into the environment in which our children are in. Next slide, please. So from collecting this data, what the infant mortality review team does is we have robust discussions to really identify gaps and trends that the District of Columbia can work to address. And what we observed is that the messaging and training that was geared to safe sleep environments should account for the communication styles of our families and be socialized with multi-generational caregivers. As we saw, most of our infants are mobile. They move from home to home. We have grandmothers and grandfathers, aunts and uncles that are caring for our children, parents, friends, caregivers. It is so important that everyone be trained and be given the same information so that no matter where our babies go to sleep, they go to sleep safely. What I also want us to understand, next slide, is that all of the housing, financial exposures to violence impact the health outcomes of our families. And we have to, as providers and as clinicians, if you're on this session, we need to understand that our families are just suffering under chronic stress and making decisions under duress. In our review of the fatalities that had an unsafe sleep component, we noted that our parents appeared in the investigation process because there is a conversation, questions are asked, that they retained and understood the information, placing the infant on their back regarding safe sleep. However, what was noted is that the infants were not placed alone or in their own crib, bassinet, or approved safe sleep environment. So they were being found on their back in an adult bed. They were being found on their back amidst adults, other children. And so we, as the infant mortality review team, know that some of the information is being retained and utilized, but some is not. And that I hope, as we get more into conversations with our families and communicating with our families, that we can really try to help them see the benefit of doing all of the recommended guidelines. Also know that there's a need for whole family education. Fathers, girlfriends, other adult or juvenile caregivers, once again, anyone who has a touch with that infant. Next slide, please. As I've mentioned before, the infant mortality review team identified the chronic stress and the social determinants of health as several of the major components that affect our families of all the reviewed decedents. And for inclusivity and accessibility to occur in terms of sharing this information and resources, we have to address those issues for our families. The team also indicated that it was important to provide peer support, coaching to our families to strengthen that back to sleep message so that they could encourage the caregivers' efforts, reinforce that safe sleep education. And we know that's really critical so that we can provide equitable resources and services to our families. One thing that also came out is that we found that as providers, it's important to share with our families and our caregivers the why of the ABCs, alone on the back in a crib in a smoke-free environment, so that our families understand that there is a real physical issue, a reason why infants need to be on their back, why physiologically smoke environments are not safe for our infants or for them to be dressed or covered with blankets or too warm. Our families, I believe, are needing to understand the why, not just to do something. Next slide, please. I want to thank you all for being here today. I want to thank Dr. Giese. I also want to thank Sharon, and I'm so looking forward to hearing Barb really help us understand how we can take this to the next level for our families.
Thank you so much, Jackie. It is my pleasure to be here today, and thank you all for attending. It's a wonderful opportunity for us to share this information, and you'll hear hopefully that I'm going to build on what has been said. We have all heard the recommendations that Sharon shared with us, and if you'll go back a minute, and all of those American Academy of Pediatrics recommendations, those came out in 2016. And just FYI, you get this information today, don't think you've got it all. It's there, they work every 5 years, they come out. American Academy of Pediatrics is right now in the midst of getting those finalized. And hopefully by the end of the year, the new updated recommendations will come out. So at 2021 is when they should come out. Pandemic, plays a role on everything. And so it may be the first of the year, but it certainly is coming up. So keep that in mind and keep looking for those. despite all of the available information, you've heard it, far too many babies die each year, but even more so, there is a racial disparity that goes along with these deaths. You've heard it and you know it. And for every one white baby that dies, 2 Black babies die. This is a travesty, and we cannot sit back and continue to do the same thing over and over and expect a different outcome. I think that's the definition of insanity. So we at First Candle are really looking at, for the last 5 years, we've been looking at what are we doing and what can we do different. But despite listening to all of the information that you've heard earlier, we all have heard that. But as you look at this photo, you've had an opportunity to be looking at that while I've been talking. We all see things and hear things very differently. So some of you may have look at this picture and see a lake landscape with a couple on the right-hand corner down at the bottom, looking out over that. Do you see that? And yet others may see the outline of an embryo or a little baby there. So again, 2 different things. I'm sure you've seen The Beautiful Lady and The Witch. There are a lot of new ones that are coming out now, but we all see things in a different light. So if we can take the blinders off and listen to and do some self-reflection, what are we seeing? What are we hearing? What are we doing? And how can we make some changes? Next slide, please. Oh, is that the next slide? Okay, well, there are many factors that influence a parent's decision about safe sleep, where their babies are going to sleep and how they're going to be fed, so breastfed or where they're going to sleep. It can be family, cultural norms. It can be socioeconomic, don't have a safe place. Keep in mind what that sleep environment looks like is either safe or unsafe due to what is in that sleep environment. So you can have the most expensive crib in the world, but if you throw pillows and blankets and bumper pads and stuffed animals in there, it's not safe. Or you can have a dresser drawer or a laundry basket. And again, if you put a big fluffy pillow in it, it's not safe. But if you put just a light, thin receiving blanket, you now have a safe place for your baby to sleep. So a lot of things that come into play. Past experience. If you've had a baby die, you may want to keep the baby closer with that subsequent child, that rainbow baby, or a desire, you've gone back to work, you want to bond with your baby, you want to sleep with them and breastfeed. So a lot of these things come together to make a decision of where a baby will sleep. Next slide, please. And where families are learning about their infant care. All over the place. So hopefully we get them from healthcare professionals, but there are various touch points in a life. Grandmothers, elders, trusted family members or community members. And that trusted family or friend or family member may be, a peer that had a baby a year ago and may not have all the information correctly. It might be another teen mom. It could be someone that's gotten their information from Google online. We know there's a lot of good information out there, but we have to make sure that our families are on credible sites getting their information. And sometimes Dr. Google isn't really the place to get that information. So we want to make sure that parents get the appropriate information. This is really important. We know that people will get information. In 2015, 75% of parents use social media for parenting information and support. And Facebook was the most popular among all races and ethnicities. I think now maybe TikTok's coming up to take some of that, place of some of that. But important information that they get accurate. Next slide, please. Messages come from everyone, and they need to. And so I went through and saw who all are in attendance and the disciplines, and even just from our panel, it's important that as soon as a lady finds out she's pregnant, that she start getting that information. She starts thinking about where is her baby going to sleep. That's an optimal time to talk to women about having a baby and where their baby's going to sleep. They're hungry for information. They have the time. And so it's a great opportunity. And again, every discipline has an opportunity to have that conversation. I think you have to hear something like, 7 times before it becomes a norm or a mindset. So if you look at that, if the clinics, the OBs, the doulas, midwives, lactation consultants, nurse care coordinators, visiting nurses, midwives, doctors, nurses, everybody has that opportunity. And although it might not be in your job, this is a chance to change that thought process, not from this is not my job and I don't have time for this, but rather to be, this is my opportunity. Next slide, please. So really being able to convene a coalition, a task force, a group of all these different disciplines to come together and to make sure that we're giving the same information. I love that picture of the umbrella. It's very clear what we're talking about, because I think Dr. Giese said it, they're interchanged and used inappropriately at times, so that we know what the terms are, we use them, we know what the messaging is, and we adopt a uniform message and learn what each discipline is going to be sharing, looking at the culture and resources for families. I loved Sharon shared her information on how to contact her and organize some new supports for families. Next slide, please. We all have one thing in common, don't we all? We're all exhausted, but add a new mom and parents to that, caregivers for that. That is just, it's unbelievable what the stress is that goes along with that exhaustion. So really empowering our families to have a plan. So, you know, this is what we're going to do. We're going to breastfeed, or we're going to put the baby in a crib, but where that baby sleeps the first 2 weeks generally tends to be where that baby will continue to sleep. So having a plan to know this is where my baby's going to be, this is a safe place. And if you start there, hopefully that will be the preferred sleep position. But have a plan, because at 3 o'clock in the morning, when that baby's fussy, we tend to make decisions that aren't always the best decisions. So have a plan, have your partner, have someone you live with, a grandparent, whoever that, if it's a multi-generational household, have someone that's going to be your respite care for you to have a break, to get some sleep, to be able to know what can we do. It sounds kind of crazy, but turn off the electronics. A real easy one. When you get a chance, families, friends all offer, how can I help? I want to come help. I want to do this. Make a list. Tell our families, get a list, all the things that need to be done. Put it on your refrigerator. When someone offers, say, this is great. If you take our laundry home and clean it and wash our clothes, fabulous. If you come and let me get a nap, wonderful. If you run the sweeper or do the dishes, make us a meal. Have a list of things that you can offer to families, and then have that game plan so that when that baby's crying, I know what I'm going to do at 3 o'clock in the morning. Next slide, please. This is a quick and easy one because Jackie already talked about it. Stress-filled lives and what all those things, and acknowledging the issues that we all have or that our families have. And so we got a lot of stress on ourselves. Let's look at what can we do? How can we help our families, our patients, our clients? When you look at food insecurities, when you're looking at homelessness, there's just so many pressures on young families today. Let's find those resources, make a list. Domestic violence was another one. You can't just give that resource when you're suspicious of some violence in the home. Give a whole list of resources, and that's one of them, so that it's not a flag when someone brings home or has a number for domestic violence. We're setting our families up for more trouble. So have a resource, be able to identify that and give them all that list all at once. Next slide, please. Was talked about what that sleep environment should look like over and over again. But this, I don't know if everyone's aware of this, but the incline sleepers, the pack and the rock and plays, but all incline sleepers have been recalled. So a good thing to include on that recall list or on that resource list is Consumer Product Safety Commission recall list. And there's a site that you can sign up for, and it will let you know what has been recalled. These have all been recalled, but I bet there are other people on this call today that will attest to that. If these are taken off the market, there's still hundreds of thousands of these out in people's homes. And you have maybe heard the same thing that I have heard multiple times. I couldn't live without this. This is the only way I could get my baby to sleep. And so we really need to know and realize that everyone needs to know these are dangerous. And it's not because of any other reason that too many babies are dying in these. And they need to know that. I've had parents say, oh, well, I heard it's just because they fall off. Well, no, it's because they've died in those rock and plays. Flat and firm is what the recommendation is for babies to sleep. Next slide, please. There's some more of these, the positioners and sleep environments. This elephant, it was all over Facebook. And when there were some posts about it not being safe, it was said that, well, they aren't for sleep. They might not be for sleep, but all the pictures are babies in them sleeping. So we have to really look at what the devices are and if they're safe or not, and how we can make sure that we educate our new and expectant parents and grandparents and caregivers. And if you look at this last, the one down there at the bottom, the nap nanny, it was recalled in 2013. This was another post that was on Facebook, and it was Throwback Thursday. And this mom had a picture of her baby in that, and home phones ringing. I'm probably one of the few people that has a landline left. So the nap nanny was, her baby was in a nap nanny. And then they got, there was a comment, oh, that's so cute. Your baby's so cute. And she says, well, now he's 5 years old. And you know, he's so much bigger now. And then they said, well, that's a great little thing. I love that little thing he's sleeping in. Where did you get it? And she says, well, you can't get it anymore. It's been recalled. Too many babies died in it. And then somebody else comes on and says, oh, well, you can get it on eBay. So sometimes social media is great, and then other times it's not so much. So again, that we look at and share accurate, appropriate information. Next slide, please. We talked about that a flat, firm surface is where babies should sleep. And you can see some of these, it wouldn't take much for that baby to scoot there in the pink and turn her head a little bit more and get into that fluffy bedding. The straps that come along as a baby relaxes and falls asleep, they just relax until they're dead weight. They just keep going until they can hang themselves. I'm sure these are things that anybody that's been on a child fatality review team has been able to see. So these are not sleeping devices. Let's face it, they fall asleep when they get in the car and they're in the car seats or in bouncy seats and things like that. But we want to make sure that once you get to your destination, babies are taken out of those and laid in a flat, firm surface. Next slide, please. So we've talked about what all these recommendations are, and here's a few suggestions about that we can help families think about when they are preparing for a baby to come home. So think about if someone smokes in the home. I hear often, well, we're not going to after the baby's born. So what do you want to do? So you need to prepare your house and think about what, and this is another thing, people want to help. This is a great way. Wash down the windows and the walls. How many have you ever washed down a window that someone has smoked at? You look at that rag and it's all brown. That's what's going in our lungs and our baby's lungs. So we want to wash those down, clean the carpets, clean the furniture. This is that second and third hand smoke. The same way in the car seats and dashboards, that someone that smokes in that car, even if the baby isn't there, the residual smell and things are in the car. Another suggestion is maybe a little jar or bowl or a can of charcoal in the car to kind of pull some of those smells out. Next slide, please. I think we have some questions coming too, but everyone has a story. We all have them. Next slide. We can do some self-reflection and think about a time that you felt different, left out, not heard, because of your race, because of your gender, because of your age, because of your disability. We all have something that we've felt uncomfortable about. Next slide, please. And again, we all, even as caregivers and care providers, we may have experienced some of these adverse childhood experiences. A childhood experience that has significant lifelong impact on our health and the quality of our lives. And it's linked to risky behaviors, psychological issues, serious illnesses, and even death. So some of those are child abuse, physical, mental, verbal, neglect, just being left kind of on your own, household changes, divorce, separation, incarceration, addiction, all those things that we may have grown up with tailor us to who we are and what some of our lives tend to be. Next slide, please. Kind of talked about it. What can be done? We can look for and get those resources. Form that group, that task force, that group that will come together and look at what are the resources, home visiting programs for pregnant women and families with newborns, parenting classes, domestic violence prevention, mental illness. We heard this over and over from Jackie, substance abuse. One that we haven't mentioned is quality childcare available. I don't think we talked about that, but community supports for families and for parents. Next slide, please. Self-reflection, looking at that. Cultural awareness requires us to be open and honest. We just have to face what we, and understand that our life experiences, our lived experiences and beliefs play a huge role in who we are, what we think and how we act and do. So it's important for us to look at and own our biases and ask ourselves, why do we believe that? What makes us think that? Where did these come from? And how can we address them and move forward? Next slide, please. So some of the things as we look at our practice and do this self-reflection, think about our body language. How are we dealing with our families? Are we sit down and eyeball to eyeball with them? Do we stand over them and ask questions and looking down at them? Do we ask in a judgmental way? Are we listening and hearing what our families are telling us? Are we meeting each one where they are? Are we treating them as unique as each one is? And are we checking our assumptions when we meet that new family? And do we believe in them? Can we make ourselves be that trusted caregiver that families so desperately need. Next slide, please. Culture awareness. Gosh, one size does not fit all. So we said it, meet your families where they are, ask open-ended questions. So if you ask those yes, no questions, that's what you're going to get, the answer you're going to get, a yes or a no. But rather tell me about, I don't, you know, what do you know? So what have you heard? So again, respect their perspective. Next slide, please. This is, I think Dr. Giese mentioned it, the worst day in a family's life when a baby dies. So navigating that is a rough, bumpy road. And we want to be sure that we offer support to our families. We don't have good bereavement time off for families. They're left oftentimes, and we get calls from families that it's been 2 and 3 years and they still haven't dealt with the death of their baby because they have all these other extenuating stressors in their lives that they're dealing with right now. Next slide, please. Call to action, just things that we can do. Look at ourselves. What can we do? What about the materials we look at? Does it meet our families that we're dealing with? Does our office decor look like it? Do the magazines in our waiting room meet our patient population? Do they feel welcome? That's important that all of our patients feel welcome. Start and end. Talk about having patients, partners being engaged. So really looking at that task force or a group together. So I just challenge everyone to find a call to action. And I'm sorry if I've taken too much time.
Barb, thank you so much, but we do have some fabulous questions and I'm going to let Sharon Brandon address some of these because this is right in the wheelhouse of DC Health. Sharon.
Yes, to Nicole, what recommendations do we have for families who have a caretaker that smokes? In our trainings, we give the 1-800-MOM-BABY number. I know it isn't easy to just quit smoking as a former smoker, but when my daughter was pregnant with my second grandchild, who is now 9, I had to stop smoking for the sake of the unborn baby. It isn't easy, but if you call that number, they will direct you to the administration that can give pointers on how to stop smoking. Going out and washing your hands after you had a cigarette is still not good enough because you're picking the baby and bringing them to you. The cigarette smoke has saturated your clothes and it has saturated your skin. So by any means necessary, use that number and help assist them to stop smoking, especially when they're around your baby.
And Sharon, how about resources for new parents to navigate the financial stress? Tell us about getting the cribs.
DC Health has over 32 agencies that we partner with throughout the district. We provide training to the agency, who in turn provides safe sleep education to their population, and they provide a cribette, which we call a portable crib, free of charge to the family. It holds the baby up to 34 pounds, which is around 17 months. So that takes the stress off of the parent for having to purchase. And the cost is to attend education. That is it.
Thanks, Sharon. And I'll just briefly talk about the crib bumpers. And what we know is that people think that it protects the infant from hitting their head. What we know is that now with the new cribs, the space between the slats is not big enough for an infant to get their head through, so they will not get hurt that way. We also know that babies don't move with enough force to hit their heads against a slat in a crib to cause damage. And so just be aware that although they are sold, we know that from the evidence, they do not protect our babies. They just provide another way in which they can get entrapped. I also want to make sure if there are any questions, if Dr. Giese, if Sharon has anything else to add, we are just very grateful to have had this opportunity to share the information and the things that the district is doing and ways in which we can improve our care to our families. Dr. Giese or Sharon?
Thank you, Jackie. Just if anyone would like to become a partner with DC Health's Safe Sleep Program, or if they need help or resources on quitting smoking, care for your baby, call the 1-800-MOM-BABY line. Thank you.
Thank you. Dr. Giese?
I don't have anything to add, just another thank you for inviting me. And Sharon, I really commend you for the smoking cessation information that you gave, because that's really the answer, not only for the baby, but for yourself too. So if you have a grandparent or anyone else who's smoking, we do autopsies on adults as well. And there's a lot of disease that progresses from that behavior. So hopefully that information is dispersed and they can stop smoking. If there's any questions for me, I'm happy to take them as well.
Thanks, Dr. Giese. We do have a question about the PowerPoint slides. I know DC Health does them in terms of their training, and that's where those slides are provided. Our information for the Office of the Chief Medical Examiner is always going to be in our annual reports, which are on our website. And Barb, where the information for your organization, where might people be able to access?
You could email me at barb@firstcandle.org. So that's barb@firstcandle.org.
Barb, thank you. And I think for all of us, our emails are in our bios and our profiles. We welcome your information. Most certainly, please contact us. There's another question about how consumers can know which products are dubious or safe. And what you have is the U.S. Consumer Protection. They are the ones that keep track of those that have been recalled. So that's where you can go. Dr. Giese, please.
Yeah, I was just going to add that Sharon's presentation, she has that picture of the baby in the crib, and that just brings me so much joy to see that picture. All the images that Barb Hahn shows, thank you, but it's good to show people what's not the right thing too. But that picture of the baby on its back and alone in a crib by itself speaks volumes, and that's really what you want to look down in your crib and see when you see your infant.
Thank you so much. I want to thank everybody. It's been a real honor to be on this panel. I'm so glad that we got the opportunity to do this from Thrive by 5, and so grateful to be on this Mayor's Maternal and Infant Health Summit.